Russell Westbrook.
KJ's still here.
Was-
You still see?
Live TV at its best. And Monday, Rocket Guard Russell Westbrook donated 650 computers to Houston students. And last month, our favorite football team, the Houston Texans, donated $100,000 to help out Houstonians who are most vulnerable, and I want to thank Jamie Root. And these are just a few examples of the recent generosity of our city, and there are so many, many more. Today, joining me virtually and in real time is my friend Elizabeth Killinger, president of Reliant and NRG Retail. Elizabeth and her team have been a great corporate partner over the years, and I want to welcome her to City Hall. Elizabeth, are you there? Elizabeth, are you there? Elizabeth.
Are you hearing something?
Elizabeth, can you hear me, Elizabeth?
Oh, it's your preacher.
Oh, no, not the preacher.
Kids are printing. It goes off again, I'm unplugging it.
Oh. Elizabeth?
All the things that don't really matter during a
Oh,
normal
yeah.
conference.
They print two pages a day.
This
They
is
just
truly a
decided right
virtual experience.
That's how it works.
They just need to know that they're talking to the rest of 2.1 million Houstonians. Oh, you have to love it. Oh, this is the virtual coronavirus experience. Elizabeth, are you there?
You've gone over. You're going over. Is
Am
your,
I going scooting?
oh,
Yes.
Will somebody use the telephone and let them know that we're listening to their conversation? Oh, I'm just so glad they're not saying anything that they didn't want the rest of the world to hear. Like talking about the mayor. Okay. Elizabeth, are you there now?
Okay.
Elizabeth?
See, now I look centered to me, too.
Okay. Can we get them? Okay, Elizabeth, can you hear me? Maybe tell her just to hold the phone.
Yes.
Elizabeth? Just
Oh,
keep.
you want us to talk?
Yes.
Okay. Thank you, Mayor Turner. I appreciate the opportunity to join you virtually as we practice social distancing. I want to commend the hard work that you and all of our local leaders and media are doing to keep the community safe and informed. Houston is home to Reliant and our people, and we care deeply about this community, and we're committed to helping one another through this unprecedented crisis. Today at Reliant and NRG, we're announcing that $300,000 is being committed to local first responders, healthcare workers, and nonprofits as they provide crucial services to our neighbors here in this community. First, $150,000 is going to the City of Houston's new Frontline Fund to assist with much needed PPE. We're also providing $150,000 to the Houston COVID-19 Recovery Fund, which is a collaborative between the United Way and the Greater Houston Community Foundation that Jamie here with me today will speak about in a moment. These donations are part of Reliant's support in Houston and across the state of Texas, and they're a subset of our overall NRG contribution of $2 million to pandemic relief efforts. We're also providing assistance to our electricity customers who are facing hardships caused by this pandemic with payment plans and additional relief. I would just encourage, if you're out there and you need assistance, we encourage you to call or chat with us online. We're here 24 hours a day to help. As a native Houstonian and sixth-generation Texan, I've witnessed the strength and resilience of this community and have seen how we always pull together in times of need. Mayor, I want to assure you and the community at large that you can count on Reliant to help light the way in uncertain times. And I'll ask Jamie to speak about his fund as well.
Great. Well, thank you, Elizabeth, and thank you to your entire team at Reliant. You guys have once again stepped up and showed tremendous leadership for our community and support for our community. You know, Don Shula said, I know of no other way to lead than by example. You guys are setting a terrific example. And likewise to Mayor Turner, thank you for your strong leadership throughout this time of crisis and all of the challenges that our community has faced over the last few years. You know, COVID-19 has created unprecedented need in our community, especially for the most vulnerable families and individuals. These are neighbors that were already struggling to make ends meet when this pandemic hit. The sudden loss of a job, wages, childcare can leave a devastating blow to families that are already living paycheck to paycheck. The Greater Houston COVID-19 Recovery Fund, which I am co-chairing with my good friend Tony Chase in my spare time away from being president of the Houston Texans. It will help these Houstonians with urgent basic needs. Basic needs like food, health care, and shelter. As always, Reliant has stepped up across Texas to support neighbors in need, and we are very grateful for this generous contribution to the Greater Houston COVID-19 Recovery Fund. In just a very short time, we've received millions in generous donations from foundations, businesses, and individuals. And in under 30 days, we have distributed and invested $1.5 million to 30 agencies across this region. We've just started and we are already making an impact. The need for the most vulnerable is great and it's urgent. So I encourage everybody who's listening or watching out there today to join our team for Houston. To donate now, just visit greaterhoustonrecovery.org. And if you're in need, call 211, the Texas United Way helpline. Again, thank you, Elizabeth, and our great friends at Reliant for once again being champions for Houston.
And let me thank both of you, Elizabeth. Let me thank you and Reliant for your $300,000 contribution. $150,000 of that going to the Houston Frontline, which is a nonprofit within the Houston Special Events Fund, with Susan Christian over special events for the city of Houston. And that Houston Frontline Fund is being used for the purchase and acquisition of PPEs for our first responders and healthcare providers. And then again, I want to thank Jamie Root, who is one of the co-chairs of this COVID-19 Recovery Fund. And that is also a fund that is assisting so many Houstonians and people in the region in their efforts to overcome and get back on their feet from COVID-19. So thank you both. Reliant, a big thank you to you as well. Together they provide for our most vulnerable neighbors through local nonprofit organizations. I want to commend and thank them. Elizabeth, your donation will greatly benefit both citizens and city workers alike. And we had our fair share of natural disasters with Harvey, tax day floods, and so many others. And Elizabeth and her team at Reliant NRG have stepped up to support our greater community. But they don't stop here as well. They continue to support our neighbors nationwide. And I want to give a big thank you and express our generosity for what you are doing, and thank everyone who has donated, volunteered, made face masks, healthcare professionals, janitors, grocery workers, nonprofits, teachers, mothers, and fathers who are homeschooling, first responders, and all of our essential employees. And we'll work together, and we'll get past this particular crisis. So thank you to both of you so very, very much. Thank you all. Okay, that's going to end the first part. We're going to segue out. And let me also acknowledge Vice Mayor Pro Tem Martha Castek-Tatum. Thank you again. We've been at it all day, all this morning with City Council. Now, and Councilmember Tiffany Thomas, where are you? Oh, feel free to come up. She's back there. Okay, the Houston Health Department today, to give you the updated numbers, we are reporting 52 new cases of COVID-19 today. Yesterday, it was 40 new cases. Today, we're reporting 52, bringing the total case count in the city of Houston to 2,331. The total number of deaths has increased by 3, and so the total death count in the city of Houston is now 26. So 2,331 COVID cases, and then the people who have passed in our city as a result of COVID-19, that number is now 26. With respect to those 3 new cases of people who have died, one is an African-American man in his 80s with underlying health conditions who passed away on April the 8th, 2020. And then an African-American man in his 60s with underlying health conditions who passed away on April the 12th. And then the third is a white non-Hispanic man in his 50s with underlying health conditions who passed away on April the 5th. And again, when we say underlying health conditions, that means possibly heart disease, lung disease, may have been suffering from diabetes, sickle cell, asthma, all of those elements that were involved in their situation. I certainly want to extend my condolences to their families. COVID-19 continues to challenge our community, and I know it's heartbreaking to hear the daily report of positive cases and the number of deaths. But I also think we should keep in perspective that as the nation's 4th largest city, Houston has done an excellent job of blunting the progression of COVID-19 because you're staying home, or if you're an essential employee, you're working safely, and you're engaging in social distancing. And let me just say to you, all of those things, you are saving people's lives, could be saving your own, and then, of course, wearing the face coverings as well. I want to just show you a couple of charts before I yield to Dr. Peirce, who can elaborate on them even further. One chart, let me see what goes up first. This is a chart that shows the COVID-19 deaths by jurisdiction. So, for example, per 100,000 population. If you take a look at New York City, the number of deaths per 100,000 is 94.1. Okay? New Orleans is 70.6. These are deaths per 100,000. Seattle is 40.7. Chicago is 12.8. Los Angeles County is 3.6. And the number goes on. And you can see where Houston is. We're at 1.1. We're at the very end when you look at deaths per 100,000. And today, our total count, of course, is 26. And then when you look at the number of cases per 100,000, I don't know if they have that one, do they?
That's just the total number. Total number of deaths per community.
Okay. But when you look at the number of cases per 100,000, New Orleans would be first with 1,445, followed by New York. These are number of COVID positive cases per 100,000 population. New York City would be 1,272. Seattle would be 611. Chicago would be 334. San Jose would be 105. These are cases, confirmed cases per 100,000 in population. And the city of Houston would be right at 96 per 100,000. So just to kind of put things in perspective, what I do want to highlight is that the actions that people are taking in our city, those actions are working. Because oftentimes I'm asked, even on yesterday, Mayor, are the sacrifices that people are making in our city, are they helpful? Are they working? And I want to assure people, that's why I want to show them these charts. When you look at deaths per 100,000, quite frankly, we're at the end. When you look at cases per 100,000, we are way from New York and New Orleans, Seattle, those instances. And then in talking with the medical center today, with Bill McCain and others, I want you to know that there are signs that things are flattening, which is positive. And what they have said, and looking at their numbers, is that based on what people are doing already, at least as of today, the hospitals in our areas can handle the cases that are coming in within their baseline capacity. And that's good news. In terms of the ventilators, they're able to handle the cases that are coming in with the supply of ventilators that they have. And that's good news. With respect to ICU beds, they're able to handle the cases that are coming in within their baseline capacity. And so we want to keep it that way. I said before, we're going to take it one day at a time. Yesterday, we were in a position to say we've been successful. Today, I can say we're being successful. And if we continue to stay home, if we continue to work safely, if we continue to engage in social distancing, wear our face coverings, then each day, I think we can continue to flatten that curve, slow the progression of this virus, and stay within our healthcare delivery system ability to handle those cases and provide the necessary care to the people that are coming into our system. Having said that, let me pause and bring up Dr. Peirce.
Thank you, Mayor. To reinforce a couple of things the Mayor said and to go into those charts a little bit more, remember when we started all this, we said right from the very beginning, the whole purpose with all this effort was to save lives. And part of that is a very complicated strategy, which each and every one of us is living that strategy. Our deaths, when compared to other cities, remain low. And so there are the two charts that were up there, and the one just showed the number of deaths in the largest cities across the nation. And of course, New York City had a very high bar, and then the others look small. But that doesn't tell the whole story because of the much greater population of New York City. So in the other graph, the one per 100,000, it balances that, and it looks at how many deaths per 100,000. So it takes the population, the greater population of New York City. So there's the graph there that shows the total number of deaths in New York City, and it dwarfs all the other cities, but so does the population of New York City. So if we can go to the other graph, the one that is per 100,000, this takes the confounding variable of population out of it, and then if we go back to the other one again, please, this graph, if we leave it there, this takes the population density, the total population of the community, and it compensates for that. So you're now looking at more the rate of death per population. And you can see that when looked at this graph, although the letters on the bottom are very small, Houston is very far off to the right of that graph, indicating that we have a very small number of deaths per our population, which means that all of these things that we are doing, all of these strategies that have been put in place by Mayor Turner and Judge Hidalgo are working, and they're working today. Remember, I've also said before that anytime you do a public health strategy, it takes a minimum of 2 weeks before we see it reflected in the numbers. And so we've been doing this for several weeks now, and there it is. On that chart is the proof that what we are doing is saving lives. Mayor pointed out how the numbers from the Texas Medical Center from that group, that select group of hospitals, is showing some encouraging news. But I want to remind everyone that when we hit, when we hit the peak, whenever that should be, that is not game over. That is halftime. And then more work is going to need to come in as we try to, and this is not my lane, this is the mayor's lane, but how we restart society. It'll be my job to help advise the mayor on how we do that while at the same time protecting folks, because the virus is still in the community and the virus doesn't care. And if we give the virus an opportunity, it will take it. So as we move forward, everyone in the community needs to keep that in mind. And if we do so, we will continue to be as successful as we have. If you think about it, Houston is the 4th largest city in the nation. And if you look at where we are in that graph, that is remarkable. Probably not something anybody would have predicted 2 months ago. So to the viewing public, be proud of yourselves. You're doing the job. You're not done, but you are doing the job.
And so we want to encourage you to continue to do it. And again, we're not showing you these drafts to say that it's over, claim victory, mission accomplished. That's not the reason why we are showing it. The reality is, if we don't stay the course, those numbers can quickly change, as we have seen what has taken place in other cities. We're showing you these drafts and providing you these numbers to indicate to you that what you are doing in this city, those things are making a positive difference. And we need to continue to do it. That the sacrifices that we're asking you to make are critically important. Now, let me also say, when you look at the 23 people who have passed, all of them have suffered with underlying conditions, which means that there are many other people out there in our city who are suffering with these underlying conditions. And so we have to protect them. So people who are vulnerable, people who are at risk, our seniors, even younger individuals who are suffering with diabetes, sickle cell, asthma, recovering from cancer, lung disease, heart disease, all of these individuals are vulnerable. And if we don't take the necessary steps to protect them, then we all will pay the price. So that's why the facial coverings are so critically important. But I do want to thank everyone for what you continue to do. Bear in mind, we're testing everyone in the city of Houston. If you desire to be tested, whether you're symptomatic or not, we're testing everyone. Please call the City of Houston Health number to get an authorization code, and then you can proceed to the testing site. We can do up to 500 per site, 1,000 per day. So we are testing everyone, whether you're symptomatic or asymptomatic, because it's through the testing that we will be able to make the decision as to how quickly we can open up and what phase, to what degree we can open up. And it's all in the testing. So we need that data to kind of measure the degree of the community spread. Who has had it, who may have had it and recovered, all of that information will be important. Now let me turn to Chief Pena.
Thank you, Mayor. I'd like to begin my report today by giving you a quick update on Captain Capistran. He's the fire captain that was in the hospital as a result of COVID-19. Again, he is out of ICU. Last I spoke to his wife on Monday, he is doing better, he's improving, and he's hoping to be released sometime this week. So please keep him in your prayers and pray for a full recovery. In regards to our quarantine numbers, we maintain the positive trend that we've established the last week. We are down to 75 firefighters in quarantine. Throughout this process, throughout the operation, we've had 29 firefighters cumulative who have tested positive for COVID-19. 14 of those have since returned back to duty, and the other 14 are recovering at home. Our occupancy task force, they had 67 complaints in the last 24 hours, all resolved with voluntary compliance. We issued no citations. So we're trending positive as far as the protection of our personnel and the exposures, but we continue to dig that fire break. Just this week, we're introducing some new decontamination equipment that we'll be deploying out to the stations, as well as some training to ensure that we are doing the proper thing to keep the stations decontaminated and the equipment decontaminated to ensure that our firefighters are safe, have a safe working environment. And that is my report. Thank you.
Thank you very much. Chief Slinker, HPD.
Thank you, Mayor. Also some positive news. Let's continue on that trend today. We'll take it wherever we can get it. And with HPD, the main message for today is for you to know, for our citizens in Houston to know, that if you need your police department, if you need help, we will be there. We are still operating at full capacity, and we will be there to answer those calls when they come in. Our calls for service since the beginning of this have been flat or slightly decreased, anywhere from 4 to a 2% decrease. Today we're sitting at about 3% decreased from where we were last week. And so that's allowing us to prioritize those higher emergency calls, which is very good for us that our call volume is staying relatively flat. Mayor, today, for the first time since this began, since we started quarantining individuals for various reasons, we are now below 100 that are in quarantine with the Houston Police Department workforce. We're at 91 total in quarantine. That includes 68 police officers of various ranks and 23 civilian support staff. Regarding our testing numbers, we've had 163 total tests with 36 positive. This is the breakdown of that. We've had 153 officers tested, resulting in 35 positives, 84 negatives, and 34 that are still pending. We've had 10 civilian support staff tested, resulting in 1 positive, 5 negative, and 4 pending. So our total number of positive remains at 35, which is, I believe, where we were yesterday. And our return to duty of those who have been positive, that 35 is a cumulative number, like Chief Pena said from the beginning, and 11 of those have returned to work and have recovered. And so that's good news, and that's trending in the right direction. And I want to make a parallel, correlation here with the things that we're doing in the city, the things where we've received support from the mayor's office, from council, from Chief Bunick over at OEM, the things that we're doing at the police department and within the fire department. If you look, I think Chief Pena said your positive cumulative total number was about 29, and then we're sitting in the police department at 35. So very close. So the fact that we're doing similar things, the fact that we are implementing the same protocols, whether it's temperature screenings at our stations before a shift begins, the fact that we early on got on top of donning the proper PPE when we have to have direct contact with citizens, that started weeks ago, and then all the way to our employees wearing these masks in the workplace regardless of your assignment. All of those things, I think, are paying dividends, because being the 4th largest city in America, the 5th largest police department in the United States, while it's tragic that we still have one in critical condition in the hospital, and we definitely don't want to see any of our officers fall ill, I think it is a testament to what we're doing, Mayor, that in the 5th largest police department in the United States of America, right now we have 35 that are positive, and that number is not a lot higher. So I think those are some positive things today. We still want to pray for Officer Cervantes, who still is in the hospital. His condition has not worsened, but we'd still like to see some more improvement. So continued prayers would be appreciated. Thank you, Mayor.
Chief Bunick. Oh. Chief Bunick. Anything?
Thank you, Mayor, and thank you for your leadership during this crisis. The Office of Emergency Management's been working hard, coordinating and working with all the other city departments to ensure that the city is functioning as it should be. All of our continuity of operations plans are up to date, and we are getting each and every individual department the equipment they need and the protection of their employees so that they can perform their duties. The other thing I'd like to mention is the Greater Harris County 911 Board has given us a portable building that we placed in the parking lot at the Houston Emergency Center to give us additional capacity and additional space for 20 extra workstations in the event that we have to vacate a certain area, whether it's for cleaning or just to make employees feel a little bit more comfortable. It just gives us another option. Additionally, we set up 2 other work areas that aren't normally used during police and fire dispatch and 911 operations. So we have the capacity at the Houston Emergency Center to move and isolate employees as needed to keep everybody safe. Thank you, Mayor.
And then before we take questions, I know Vice Mayor Pro Tem Mother Castek Tatum has been very, very active with the other city council members and within the community. And I know you're very much engaged, and so please.
Thank you, Mayor. Just want to take a few minutes to encourage people not to get weary. All of the great strategies we have in place and what we are doing is working, but we cannot stop now. One of the things that resonated with me that Dr. Peirce said in our meeting last week was, once we reach the peak, that is not the end of the game. If anything, that would be halftime. So please continue to stay home. Wear your face coverings when you're out getting essentials. Wash your hands. Practice social distancing. We will continue to combat this virus together, and we will come out stronger in the end, and we will get through this.
Okay, at this point in time, yes.
I have a question. Just today, the governor says that he's ready to issue some guidelines based on data and science by Friday to reopen the state. You also mentioned that you have a plan yourself. Can you react to the governor's plan, and also, is it different than yours?
No, I don't think there's any unilateral plan. I mean, we're all in this together. And certainly we're going to be listening. I'm going to be listening to see what the governor has to has to say and what he offers. We're all anxious to get started, and I think we're all on the same page that we want to do it in a very safe manner, in a very judicious manner, and we want to do it based on the facts that are on the ground, the medical advice that we're getting from the medical professionals. We want to make sure that we have robust, widespread, what I call ubiquitous testing, and what that means, widespread testing. And as you can see, just this week alone, we've ramped up. We're doing more testing now than we did the week before. You want to make sure that you have all of the necessary PPEs, that your hospital infrastructure can handle if there's a resurgence of cases or as more cases come in. So there are a number of different factors. I don't think anyone is saying that all of a sudden, starting Monday, for example, that it's going to be business as usual. I don't think the governor is saying that. Certainly, I'm not saying that. My plan is a part of everyone's plan. So I don't have a particular plan. It's important for the city to work in close collaboration with the county, the people in the region, the governor, the people on the national level. So I think we're all interested in achieving the same objective. And this virus doesn't care who you are, or what position you hold, or what geographical area you represent. It has no respect of persons. And so what we all want to do, and my number one job, is the health and safety of the people within the city of Houston. So whatever that calls for is what we're going to do. But I'll be listening very intently to what the governor has to say, and we'll work in close collaboration with all of our partners.
Dr. Purse, you've been talking about testing capacity. Yesterday, according to your office, I guess even though the capacity is up to 500 per sort of left like 375 spots out there.
Mm-hmm.
So, and there are people who are calling, we're like, look, we're ready to go, but they still haven't been able to get in. How do you kind of deal with that discrepancy, or where are you guys on trying to improve that gap, clearly?
Right. Thanks for asking that question. So a number of things changed pretty quickly with testing. They were all good things, but they all changed at the same time. And so one of the things that happened was the federal government, with their new supplies that came in late last week, went from the testing where we had somebody place the swab up in the nose to a system where the individual puts the swab only about halfway up their nose. And for anybody who's watching who wants to learn about this, in case you go to the site, you'll be asked to put the swab about halfway up your nose, turn it one full time, let it sit there for 15 seconds, take it up, put it up into your other nostril, turn it again, and let it sit there for about 15 seconds. And so what we learned yesterday was that the public, while that sounds simple enough, the public had a hard time doing that. And so the time it was taking to get people through the testing sites was quite a bit longer than we had anticipated. And so that was one of the things that slowed us down. The other thing that slowed us down was that up until the end of last week, we had been using our colleagues, our friends from the hospitals, nurses had been out there, and they needed to get back into the hospitals. So we had requested some personnel from the state, and they sent us members of the Texas Medical Forces, the Texas Military Force down, and so they were getting trained, and so there was that transition was occurring as well. And then, of course, we got the news that we could test up to 500, and so yesterday was a good day in that we were ramping things up, but yes, there were a couple of speed humps. We're working through each one of those, and we expect that we'll be hopefully hitting 500 pretty routinely. And you asked me yesterday about people calling in, and so yesterday we gave out the 500 maximum for yesterday. We also gave out some numbers, some additional numbers that would be available for use today, because as I had mentioned to you yesterday, we had witnessed a fairly large no-show rate. And so we gave out quite a bit of numbers yesterday, and then we had the problem with people not getting through the traffic as quickly, which we had not anticipated. We did not think that that was going to take as long as it did, and so we got a little bit of a backup. So we're hoping, give us a day or two, we should be getting all these kinks worked out. It is absolutely our intention to have 500 persons sampled at both sites every day.
Can you talk to us about, to the extent that you can, we always get calls from folks whose parents are staying at various assisted living and nursing homes, and how
Right.
big an issue that is with the health department. What are you working on that?
Yeah, so there are a small number of nursing homes. So to give you an idea, within the city of Houston, the city limits of Houston, there are about 100 of what you would call your classic nursing home. There is another 200 or so to a total of about 303 assisted care living sites, senior living centers, so on and so forth, and nursing homes. Within that group, there are 10 sites that we are working with that either have or believe they may have confirmed cases. With the good news is that with those, with the exception of one, the numbers are very small, 1, 2, possibly 3 cases that we're working with. So we're not having the big outbreak that has been seen in the news in some places around the nation. We're not dealing with that. We do have one center that has about a dozen or so cases, and I can't give you the names. We and I talked about this yesterday. I can't give you the names of the centers. That's a HIPAA violation. But what I can tell you is that center has been very aggressive and actually has relocated all of those positive cases to other housing situations in order to protect the remaining residents. They've been, like I said, they've been very aggressive. We are also in contact, the health departments have been in contact with each of the nursing homes in the city limits of Houston, advising them with the new CDC guidance that has come out, and we're making sure that they're up to speed with all of those new guidances. And anyone who is having any special problems, we're giving them special attention to help get them up to speed with that.
Okay. And I had a question for the Chief Pena about testing. Can you talk to us about the Abbott testing and how it relates to first responders? I know a lot of people are wondering when that's going to show up.
Yes, ma'am. As of tomorrow, there's a Walgreens facility out on the 1400 block of Westheimer that will be having those tests available. There's a 15-minute test, the Abbott test, and us as well as police department will be taking advantage of those testings opportunities for any individual that requires them to go out there starting tomorrow. So that's going to be a huge help for us. You know, that's just one more avenue, and it gets us a quicker return, because the goal is to get them an answer back as quick as possible in hopes to get them back to work as quick as possible.
14,000 block thing? Not 14.
14,000 block, you're right, of Westheimer, right? 14, Westheimer and Highway 6.
And is it like a thing, did you guys work out a deal with Walgreens? They're going to specifically do, you know, firefighters and police officers and...
Chief kind of got ahead on the announcement. Live TV. There is an announcement coming on us expanding the testing. But yes, we are working to expand the testing, working with the private sector, and an announcement on the expansion of the testing will be coming fairly shortly. Maya, you're just too good. You just was not supposed to ask that question.
Dr. Paz?
Camaro from
Yes, sir.
KHOU. Will Houston testing sites expand to offer antibody tests? If so, when could those tests arrive, and how many could we get?
Well, we're working to expand testing. Those who to test people whether or not they have COVID-19, and then we're also working to get in tests into our city to test for the antibodies as well. Both sets of testing will be needed, and that will determine just how quickly we can start to open up. So those are conversations and that are taking place right now, and I think you'll start to see some announcements coming as we move forward.
One more from KHOU. Are undocumented and or uninsured people able to get tested at the FEMA-supported sites?
And the answer is yes. In Espanol, sí. Everyone, it's everyone, okay? Sinner and saint. Whether you're black, white, brown, Asian, doesn't matter. Whether you're documented or undocumented. If you are living in the city of Houston, then you are eligible and encouraged to take advantage of the testing sites.
They have a question about mobile testing. That was similar to what Maya was asking, right?
The mobile testing, I'll yield to Dr. Peirce.
Okay. So they want to know how close is Houston to getting mobile testing to reach people who can't get to the city's 2 testing sites?
Yeah, so we're working on trying to get testing out into particular neighborhoods. Our strategy at this point, what we're working on is predominantly at fixed sites. However, we do have another plan that is in progress about getting mobile sites. We recognize the county is going with the mobile platform first. We're going to go with the fixed sites at as our first step, and then we'll get to the mobile. Well, one thing about that is that when the FEMA testing sites were first being proposed, the federal government did talk about providing some mobile testing capability, and so we're still in conversation with them, but my understanding is that those have already been deployed across the nation, so we're going to have to develop our own.
And Fox has a question for HPD. Any idea why we are seeing an uptick in shooting and homicides? What does it contribute to?
Well, as you know, every year as we approach the summer months, we get a little bit concerned about possible increases in violent crime. We see that from year to year. Crime is cyclical throughout the year, and there are times when we see those things happening. I can't say that we're going to attribute this to anything that's necessarily related to COVID, but we have had several retaliatory gang shootings in the last week, stuff that we're working on very hard every single day. I can tell you that the majority of the uptick in shootings that we've seen have been gang-related, and that has been the nexus. And so that's something that we're working hard on, which is another reason why I mentioned it's great that we're up to full operational capacity and our officers are deployed in full force to try to get a handle on some of that slight increase in violent crime that we have been seeing. We have been seeing an increase in homicides, but there was a slight increase in those numbers before COVID began that we were combating. As you know, the mayor, even before COVID began, gave us additional dollars in overtime for us to get on top of this and start to combat that violent crime. Very confident that we will do that. Our officers will be out there in full force. But the reality is when people are gathering and when people are outside of their normal routine and we have some of this violence that's occurring, especially in our gang community, and then we have retaliatory shootings on top of that, it's problematic for us. But we're staying on top of it. I don't think it's something that we can't get a handle on, and I don't think it's such an alarming increase that we won't be able to have a positive impact if we continue to work hard on it.
Dr. Pez, some of our consultants at the Texas Medical Center work in collaboration with the WHO, and you are aware of the little differences and conflicts which are going on today. So people like Professor Dr. Peter Hotez and the others who are working on the vaccines and related issue in collaboration with WHO and FAHO may be affected somehow. What are your reflections on if you were called to advise on what is the stalemate which is on? What would you say?
So I missed the very first part of your question. Were you, so could you just tell me?
I was saying that we have consultants at the Texas Medical Center like Peter Hotez and the others who work in collaboration with the WHO, with PAHO, and related institutions around the world. And you're aware of the conflicts which is going on with the sudden termination or suspension of America's commitment financially to the WHO. So I'm like, what are your reflections? What do you think all of that, how will it affect the work that is coming out of here?
Well, that's a bit of a political question. If the mayor will allow me to I'm not a political person, but certainly funding to the World Health Organization is fundamental. The World Health Organization is a non-denominational, it's non-political, it is an organization of scientists from around the globe that work on monitoring illnesses around the globe, particularly for pandemics. So it's some of some of the world's greatest experts in pandemics. And so I can't see how the reduction in funding is going to be helpful at this time. I've heard the president's comments, and he has his thoughts, but at this point I struggle to see how it's going to be helpful. If you want to deal with questions about the funding at some other point, that's fine, but today is probably not the best time to withhold funding from the World Health Organization. So I hope that other nations will step up to fill that gap. I recognize that the World Health Organization has chronically been underfunded, and they're pretty good at being efficient with the dollars that they have. And my expectation is that they will figure out a way to continue to do the job, and let's all hope that they succeed at that.
Look, I want to thank everyone. Let me just put a plug in for the census. Please respond to the census. Right now, a little over 40% of Houstonians have responded to the census, and that's a long way from what we need. And so we need the research dollars, the grant dollars to be able to fight viruses like COVID-19. So let me encourage you while you're in the safety of your homes to please take the time, go online, fill out the census, please. Everyone will benefit from it. Having said that, thank you all for coming today. Appreciate you.
Mayor Turner and his team with the latest numbers on the COVID-19 response within the city of Houston. And probably the one takeaway from this press conference today, the mayor being told by people at the Texas Medical Center that it appears that the curve is starting to flatten here in the city. So that is good news. There are still a lot of positive new cases today, and unfortunately 3 new deaths that the mayor reported. Now 26 people have died from coronavirus here in the city of Houston. We'll break down all the new information from the day. Also waiting on a press conference from the president in the 4 o'clock hour. We'll see you for the 411 here coming up in about 10 minutes.
Brothers and sisters?
Yes. I got one big brother and one big sister.
I didn't ask you that yet, Liam. I'm gonna have to tell you to only speak when spoken to. Can you follow those instructions?
Yes. Jenna.
There you go. Okay, so I have 5 brothers. You guys ever heard of my brother Donnie?
Donnie, yeah, he's on Blue Bloods.
He is on Blue Bloods. Have you ever seen it?
Yeah.
Oh, I haven't, but I heard it's very good. I have 4 kids of my own, and that takes a lot of time and attention and a lot of money. All right, who knows where babies come from?
Your mom's belly.
How did the baby get in there? All right, I'm gonna explain it to you, okay? If Francis and Pat wanted to have a baby, and Francis said, okay, I got this baguette, and I'm gonna put it in Pat's corn chowder, and then they're gonna have a baby.
That sounds awkward.
All right, what's another word for making a baby?
Pregnant?
No, that's what happens when you do the act of making a baby. Have you ever heard whoopee?